This is a lecture on mental health disorders of children and adolescents. So these are my grandchildren. They do not have mental health illness, but they sure do exhibit some bizarre behaviors once in a while. The oldest is Corey up on the top left. He's 15 and he's a typical teenager. Hayden and Tegan are both 8 and they're totally opposite of each other. I describe them as Tigger and Eeyore. Hayden is on the left. He bounces and bounces saying, "Grandma, Grandma, 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 Grandma," until you answer him. And Tegan's on the right and he's like, "Okay, here we go again." Chase, he's 4. He's on the bottom left and he is a new superhero every day. He even makes up his own with new superhero powers. And then Presley and Cammie are the newest additions. They're on the bottom right. Presley's 17 months old and Cammie is 7 months old. And I think they're going to be the second set of Tigger and Eeyore because Presley is constantly go, go, go. She can walk now. And Cammie is just very laid back. She'll lay there. She'll be like, "All right, okay, well, maybe I'll take a nap." So these children have normal mental health. But let's talk about some that don't. So let me give you a few statistics. 1 in 5 children and adolescents in the United States has a major mental illness. 2/3 of all young people with mental health problems are not getting treatment. Suicide is the 3rd leading cause of death among individuals aged 15 to 24, and the 6th leading cause of death for 5 to 15-year-olds. And for every older teen or young adult who takes his or her own life, 100 to 200 of their peers attempt suicide. So a child raised by a depressed parent is at risk for developing anxiety disorder, conduct disorder, and alcohol dependence. A child raised by a parent without effective coping strategies is at risk for developing learned helplessness, anxiety, apathy, and the inability to learn how to master their environment. An emotionally unavailable parent places the child at risk to be unable to make emotional attachments. Abused and neglected children are at risk for emotional, intellectual, and social handicaps, and identification with aggressor and development of bullying behavior. Characteristics of a mentally healthy youth, like my grandchildren that I shared: they trust others, they view the world as a safe and supportive place, they correctly interpret reality, they have self-concept that is positive and realistic, they're able to cope with anxiety and stress, they attain age-appropriate developmental levels, they develop creative ways of self-expression, and they typically have good friends. Pervasive developmental disorders include autism, Asperger's syndrome, which is high functioning autism, RETT'S disorder, which is mild childhood autism, and childhood disintegrative disorder, which is severe autism with delayed onset. Autism is a behavioral syndrome resulting from abnormal left brain function, including language, logic, and reasoning. It's usually first observed before 3 years of age. Presenting symptoms include impairment in communication and imaginative activity. They have language delay or absence, immature grammatical structure, pronoun reversal, inability to name objects, stereotyped or repetitive use of language, high-pitched squealing or giggling, repetitive phrases, babbling, sing-song speech, lack of spontaneous make-believe play, and failure to imitate. They have impairment in social interactions, like lack of responsiveness to and interest in others, lack of eye contact and facial response, indifference or aversion to affection and physical contact, lack of sharing interest or achievement with others, failure to develop cooperative play with their peers, and lack of friendships. Markedly restricted, stereotyped patterns of behavior, interest, and activities that include rigid adherence to routine and rituals with catastrophic reactions to minor changes in that, stereotyped and repetitive motor mannerisms, and preoccupation with certain repetitive activities that is abnormal in intensity or focus. Asperger's syndrome is recognized later than autistic disorder. It's usually first observed after 2 years of age. There are no significant delays in cognitive and language development or in self-help skills, but severe and sustained impairment in social interactions, lack of interest in activities, and delayed motor milestones do occur. Social interaction problems are more noticeable when the child enters school, as are problems with empathy and modulating social relationships. Rett disorder is seen only in females with onset before age 4. Characteristics include persistent loss of manual skills, problems with coordination and gait, severe problems with expressive and receptive language, and loss of interest in social interactions. Development of stereotyped hand movements like hand wringing and severe psychomotor retardation are also present. Developmental assessment should look for spurts or lags, unevenness, loss of previously acquired abilities. Relationship assessment between the child and parents or caregivers may show lack of bonding and anxiety and tension. And risk for abuse is higher with children who have behavioral or developmental problems. Some nursing diagnoses include impaired social interaction, impaired verbal communication, and delayed growth and development. Interventions center around helping the child reach his or her full potential by fostering developmental competence and coping skills like increased interest in reciprocal interactions, fostering social skill development, facilitating expression of appropriate emotional responses, fostering cognitive skills, and development of self-control. With attention deficit hyperactivity disorder, affected children show inappropriate inattention. They're easily distracted by irrelevant sights and sounds, have failure to pay attention to details, make careless mistakes, have difficulty following instructions carefully and completely, lose and forget things needed for a task, and are easily bored with things they don't enjoy. They are, however, able to do things like play video games and play with Legos because they do enjoy them. They may also show impulsiveness by blurting out answers before hearing the whole question, and having difficulty waiting in line or for their turn. They are sore losers as well. They also show hyperactivity with feeling restless, often fidgeting with hands or feet, squirming, running, climbing, or leaving a seat in situations where sitting or quiet behavior is expected. They touch everything and they may make continuous clicking sounds. They have low tolerance for frustration with temper outbursts. And ADHD may be associated with oppositional defiant or conduct disorder or Tourette's disorder. You should assess relationship between child and their caregiver. Assess the caregiver's understanding of growth and development, parenting skills, and handling of problematic behaviors. Assess cognitive, psychosocial, and moral development for lags or deficits. Observe for level of physical activity, attention span, talkativeness, ability to follow directions, and impulse control. And assess difficulty in making friends and performing in school. Some nursing diagnoses for ADHD can include risk for self-directed or other directed violence with an outcome to remain safe, defensive coping with an outcome to learn effective coping mechanisms, impaired social interaction with an outcome of developing friendships with peers, and chronic low self-esteem with an outcome of developing self-esteem. Nursing interventions include behavioral modification, special education programs, psychotherapy, play therapy, and pharmaceutical agents can improve long-term effects if treated early. Methylphenidate or Ritalin is a mild CNS stimulant that's short-acting. Quilivant is milder and longer-acting, 12 hours, and won't interrupt the school day with going to the nurse's office. Amphetamines like Adderall are CNS stimulants and are short-acting. They release norepinephrine and dopamine and stimulate the release of serotonin. Vyvanse is long-acting, 12 hours. Concerta is medium-acting, 8 hours, but Concerta has a rebound effect which can show as aggression as it's wearing off. Oppositional defiant disorder is a recurrent pattern of negativistic, disobedient, hostile, defiant behavior toward authority figures without serious violations of the basic rights of others. Characteristics include loses temper, argues with adults, actively defies, refuses to comply, deliberately annoys people, blames others for mistakes, is easily annoyed by others, is angry or resentful, spiteful, or vindictive. They don't care about losing their privileges as long as they win their battle. This is often a precursor for conduct disorder. Your assessment should include identifying issues that result in poor struggles, when they begin, and how they're handled, and assessing severity of defiant behavior and its impact on the child's life at home, at school, and with their peers. Some nursing diagnoses include ineffective coping and impaired social interaction. And interventions include outpatient treatment with individual, group, or family therapy, and with part of the focus on therapy for parenting issues. Conduct disorder is characterized by a persistent pattern of behavior in which the rights of others and age-appropriate societal norms are violated. So that's the difference. Childhood onset conduct disorder occurs prior to age 10, and it's marked by physical aggression, poor relationships, lack of guilt or remorse, and low self-esteem. The youth with adolescent onset conduct disorder demonstrates less aggressive behavior and has more normal peer relationships, tending to act out misconduct with the peer group instead of against them. Conduct disorders frequently progress to adult antisocial personality disorder. Bullying is observed in children with conduct disorder, and at least half of children with conduct disorder continue to experience problems as adults. Your assessment should include assessing seriousness of disruptive behavior when it started and attempt to manage it. Assess levels of anxiety, aggression, anger, and hostility towards others, and ability to control destructive impulses. And assess for moral development for the ability to understand the impact of hurtful behaviors on others, for empathy and feeling of remorse. Nursing diagnosis includes risk for other directed violence, and interventions include inpatient hospitalization for crisis intervention,